Good morning, everybody. Thank you very much for coming to this session today. We have a great topic today about integrative medicine. And Dr. Scott introduced that very well. And what I like about his introduction was he highlighted what is integrative medicine, which shows that around the world, there's confusion about this, because depending on who you ask, they may have a different answer. And so what is so important about this is that, unfortunately, the field of integrative medicine and the field of conventional medicine have often existed in two different parallels. And unfortunately also is that the patients are very often in the middle, participating in both. And the two sides of what we would call integrative medicine and conventional medicine are not always talking so well together, which is resulting in a bit of a fragmented experience for our consumers. So for this session, what we really want to focus on is how do we break down that fragmentation? How do we look at this wonderful field of integrative medicine and bring it into the conventional system that can really benefit our communities and our patients? So to help us to do that, we have a wonderful panel of speakers. Please let me introduce you to them, and then we'll get into our discussion. I'd like to start, please, with His Excellency Dr. Amin Al Ameeri, who is the Assistant Undersecretary of the Health Regulation Sector at the Ministry of Health and Prevention. We'd like to welcome Dr. Amin. Next to me, we have Dr. Janethy Balakrishnan, who is the President of the Association of the Integrative Medicine in Malaysia. Dr. Janethy. Dr. Myeong Soo Lee, who's the Principal Researcher at the Korean Institute of Oriental Medicine in South Korea. And you've had the pleasure of already meeting Dr. Scott, but we'll welcome him again, the Chairman and Co-founder of the Plantation Project in the US. So I'd like to start with all the panel first and really talk about the importance and relevance of integrative medicine in your various countries. I'd like to start with Dr. Amin, not only the importance, but a little bit about the history, because you've told me a little bit about that, and it's fascinating. We'd love to know.
Thank you very much. First of all, it's my profound honor and pleasure to be here with you. Let me speak about my beautiful country, the United Arab Emirates. The traditional medicine is deep-rooted at the history of United Arab Emirates, and it has been started long time back with the herbal medicine, hojama, and the rest of the practices. And while UAE is the most global country, we have almost close to 200 nationalities living in peace, bringing their own traditional practices and medicine with them living here in this country. Therefore, there was a need in establishing the first center in the country, and may in the region, which was Zaid Herbal Center in 1989. And since then, the support came up to support the TCAM, which stands for Traditional Complementary Alternative Medicine. In 2002, the Ministry of Health established the unit of the herbal medicine and alternative medicine in the UAE. In 2011, the government of UAE established the policy and the standard of the TCAM, which supported the proper practice under the control of the government and health authorities properly. Having said that, in 2017, there was a decree from the government of the UAE, decree number 20 in 2017, for the PQR. PQR stands for Professional Qualification Requirements, which includes all the practices, certificates, guidelines of each health professional to be practiced in the UAE, including 12 number of the practices for the TCAM: Ayurveda, homeopathy, Unani medicine, herbal medicine, the Chinese medicine, acupuncture, and the rest of it. And since then, this has been well supported, and the integration of the TCAM into the conventional medicine has been taken place. And therefore, using of the traditional medicine has a significant importance in the United Arab Emirates. And since then, if today I can tell you that we have almost plus 2,100 facilities plus 2,100 practitioners practicing TCAM, including integrative medicine among the hospitals. We have plus 300 technicians approved through the PQR system, and we have more than 180 facilities at the field of the TCAM, which it means that integrative medicine, it's a major part of the practice in the UAE. And as you know that integrative medicine, it's the medicine which treats the whole body, the mind, and the spirit, rather than only the disease or the symptoms. Mm-hmm. And therefore, this goes aligned with the vision of the UAE, the 2031, that it supports the holistic system of the healthcare services in the United Arab Emirates.
It's really amazing, such a rich history of integrative medicine here. Can I ask Dr. Janethy, Dr. Lee, Dr. Scott, in one sentence for each of your respective countries, what does integrative medicine mean in Malaysia, Korea, US, in a simple snapshot?
Okay. In Malaysia, what's very established is modern allopathic medicine. But then, since 2016, we have already, there is a medical act and medical council for traditional and complementary medicine. For traditional, we have traditional Chinese medicine, traditional Indian medicine, and traditional Malay medicine. And complementary, what's established is homeopathy, osteopathy, and chiropractor. And basically, this is very well respected because we come from it's multicultural. And even somebody like me, my mother is from China, my dad is from India, and I live in a Muslim country. So we understand this is ancient wisdom, and the government and the people, especially from the bottom up, they've realized that we cannot ignore traditional and complementary medicine.
100%. It's deeply rooted into the Asian culture. Dr. Lee, for Korea, what does it mean?
Yeah, South Korea government recognized the traditional Korean medicine as a valid health system, and it is integrated into the national health insurance system, and patients choose both the conventional medicine and or traditional medicine. In the patient point of view, we demand more integrative treatment in one space. It is our future solution.
I think that's great. As you said, it's what patients demand.
Yeah.
And Dr. Scott, in the US?
Yeah, in the US, I would say it's evolving quickly. There have been a number of TCAM practices that have been well recognized and reached a level of evidence that they're now being covered by insurance. And once you reach that threshold that insurance covers the practice, it becomes integrated very quickly into traditional practice.
Fantastic. So I want to go a little bit deeper now. So there's obviously a rich history there, but I'd like to look at what are some of the factors we need to consider to bring this ancient wisdom, as you say, Dr. Janethy, into the healthcare sector. So, Dr. Amin, I'd like to start with yourself. We know that integrative medicine has benefits. Possibly we've benefited ourselves or our family from this. Do you think there are potential risks that we need to consider also?
Yes, we believe in the integrative medicine. As I said, it's a treatment of the whole body, the mind, and the spirit. But it has a risk if it has not been regulated. Many countries, unfortunately, integrative medicine or TCAM is not regulated. That's number one. If it's not integrated, it have a risk. If it is not based on the evidence-based medicine, because it's very important that any sort of TCAM practice has to be with evidence-based medicine. It has to be licensed properly from the government. It has to be controlled. And you have to make sure that the ingredients or the medications, like herbal medications, different homeopathy medications they are using, it has to be controlled, well recognized, with evidence-based. Otherwise, really this will lead to a sort of complications. Now, there are other risks if there is a sort of gap between the conventional medicine physicians and the TCAM practitioners. If there is a gap between both, this will lead to the complications onto the patients, and that need to be well considered. And we have to make sure that should be proper training and credential for the TCAM practice to be integrated onto the conventional medicine and to shorten the gap and to make sure that we will be able to provide the proper training programs to enhance the practitioners of the TCAM, and this to be linked with the conventional medicine, that the proper integration will lead to the success, and this will lead for sure to the, for the sake of the individuals. Therefore, with the benefits of the TCAM, with the integrative medicine, it has a risk and it has to be taken care by the governments to make sure that the integration will be done very smoothly and it will be on a proper way that it will enhance the health of an individuals.
That's great. I really appreciate what you say, and I would like to take two parts you mentioned, the regulatory framework and the research. So from a regulatory side, Dr. Janethy, in Malaysia, could you describe how they use the regulatory framework in the development of, say, protocols and clinical guidelines to make sure this is properly governed?
Okay, it's stepwise, because before the integration, there is a very well-established regulatory framework for the TCAM practitioners, in the sense that they have to have a license to practice now, okay? And there is a grandfathering clause where if you had certifications, validation of that you're a good practitioner, that's it. Then on top of that, we have a council. So I belong to the Malaysian Medical Council, which is modern allopathic medicine, but the traditional and complementary medicine practitioners, they are under another council, Traditional and Complementary Medicine Practitioners Council. So this way, then we also have for the safety of the patients, like if you use a herb. So we have the National Pharmaceutical Regulatory Agency to validate that for patient safety. Then you have MDA, which is the Medical Device Agency, to make sure that those whatever devices you use are registered. So there's a lot of checks along the ways. Next, we are coming to enforcement. So the enforcement has also started. This is implementation and enforcement.
This is great. This is exactly the way we need to do this. There's a framework for this. And Dr. Scott, you mentioned also, so a lot of the time we think this integrative medicine is not evidence-based, but in the US, there's a lot of research that is supporting this. I'd love to know, how's the flexibility in the US of the state governments really help to allow for innovation in the US?
Yeah, in the United States, especially in the healthcare system, there's a real emphasis on science and evidence-based practices, especially when we're looking for reimbursement. And so the governments and the healthcare organizations have really promoted more research, and they've been open to reviewing that research to allow these practices to be regulated. A number of organizations have sought licensing that have been recognized by allopathic institutions, including acupuncture, chiropractic, osteopathy, just to name a few. And then the functional medicine space has also brought forward a lot of research that has assisted in validating these practices by good science as a practice that is safe, that is productive and beneficial for patients and can be utilized inside of medicine.
That's excellent. That's excellent. So it's great for the audience to know that there is systems in place, there is research there, so that we can integrate this in. Can I bring it out even further if we look at the macro environment of the whole ecosystem? I'd like to ask two specific questions. Dr. Amin, I'd like to start with yourself. Throughout this summit, there's a lot of talk about artificial intelligence. And I'd really like to know from your side, what do you feel the role of AI in integrative medicine is, if there is any role of that?
AI is the future, and we should believe in AI. And I think my country believed in AI since 2017. We had the first minister of AI in the world. And AI probably will be a great help for the human being if you will integrate it into the health system in a proper way. In our belief, AI could do a great on the integrative medicine, that you will be able to analyze the data of each an individual for the personalized medication and personalized treatments, and those data includes genetic profile, includes the diagnosis, includes the lifestyle, and this will be able to help the individuals as an integrative individual treatment program, AI could be a great help. AI can define the complications which will come up from some of TCAM, which is not evidence-based and being practiced. AI can develop the system that to control that and to make sure that proper TCAM can be integrated with the conventional by the proper study of AI. For sure, you know that existing conventional medicine is being well controlled, well tested, well modified, and well approved. But there are some sort of herbal medicine. In my country is well controlled, by the way, beautifully controlled. I'm so proud of that. But in some countries, the herbal medicine is not being tested well. AI could help you. What's the contraindication of such medications on the people by using it? And what will be the contraindication with the conventional medicine which is being used by same individual patient? That's very important. AI could analyze the data of an individual and could give me the forecast future, not only to prevent different type of diseases for this person, but we can predict. And prediction comes for the sake of the community. But there is one thing, it's very important. Now, what you do feed with AI? For instance, I'll give you one of the examples in parallel to the AI. If your active ingredients and non-active ingredients of the medicines, purity, quality is high, then you will get the best kind of medication for the people. Here, with AI, the purity of the data, the quality of the data, which you will feed to the AI system, you will get the best result. And we have to be so careful. AI will do a great help. And in my belief, the integrative medicine with the AI, it is a new era. Yes.
Yes, I totally agree. And it's quite fascinating that we take thousands of years of ancient wisdom and use incredible technology to make it more precise and more safe for our patients. It's wonderful. Dr. Scott, I'd like to ask you also from a global perspective, how do you feel that integrative medicine supports the global health agenda?
Yeah, it's a wonderful question. And going back to my presentation and asking the question, what's the root cause of the global burden of disease today? And several studies have really highlighted global burden of disease. There was a large JAMA study that the largest contributor to poor health and the largest contributor to undermining quality of life for people today are lifestyle-related diseases. Again, it goes back to the core determinants of health, what we eat, how we manage stress, how we're sleeping, how we move, and our social connections. And so by tackling those, which is really the foundation of integrative medicine, and assisting patients through all of these amazing systems, including artificial intelligence, to help them begin tweaking their behavior and nudging them to better choices and directing them to healthier diets, we can begin turning back the clock on this global burden of disease, restoring quality of life for people. The leading cause of disability globally is lifestyle diseases. And so we can begin not only like preventing this massive early death that we're seeing today, 75% of the deaths globally are related to lifestyle, and even in the United States, $4.3 trillion are spent on healthcare. 80% of that is related to lifestyle diseases.
Yeah.
But importantly, as I said, we can actually begin to restore the quality of life of people, that state of being vibrantly alive by addressing that foundation.
This is great, and we spoke a little bit, a few of the other speakers spoke about health span. It's really a change of the paradigm we look at healthcare, because for the moment, we mostly practice sick care. We're looking at transforming the way we look at it and bringing it into true healthcare. I'd like to now just touch on something Dr. Amin mentioned previously, was about the training and clinical governance for our practitioners. Because if we have the systems, we have the evidence, really importantly is, well, how are we training our clinicians and practitioners? So, Dr. Lee, I'd like to ask you, in South Korea, how has the South Korean government investment into dedicated institutes for integrative medicine really contributed to the advancement in your country?
In the education stage, South Korea has a robust system for training practitioners in traditional Korean medicine, and 12 universities across the country offer undergraduate and postgraduate course, and they manage the license. Annually, 600 new Korean medical doctor is coming out, and currently 21,000 Korean medical doctor to the clinic, and it is 26% of all medical doctors in Korea. And government also established two government-funded institutes, Korea Institute of Oriental Medicine and Korean National Institute for Korean Medicine Development. Both belong to the WHO Collaborating Center, and Korean government input $110 million per year for the research, and it is now related with developing clinical practice guideline and conducting research and integrate AI.
It's fantastic. It's so great, as you say, patients are demanding this, and the Korean government is supporting that with good academic institutions and 26% of doctors doing traditional Korean medicine. Dr. Janethy, in Malaysia?
We already have 14 universities
It's not a competition between Malaysia. Just
offering traditional and complementary modules. And we also have in the public hospitals, about 15 of them that is already integrating. They're only doing this with the public hospitals, the government hospitals, but on the private side, it's still two separate entities. And then for us, for education, we have international conferences where we actually would bring alongside allopathic and non-allopathic practitioners so that we are aware of each other, and we want to see how to collaborate and is the synergistic approach. What stood the test of time in ancient medicine and modern medicine. And now with the post-genomic era, we're also looking like what do we say about data? And data is going to help all of us. So the education is going to go, the shift is a cultural shift now to post-genomic.
Yeah.
So there's so much on education, a lot.
That's really great. As we can hear, we have the regulatory framework, we've got the research, and then you've got the academic institutions. This is going to really help to integrate. To conclude, when we look at the progress being made in this field, as we've discussed, Your Excellency, Dr. Amin, I'd like to bring it back to you. When we look at everything that we've discussed today, what are the recommendations of what you think we should do next?
We'll make it very short. Integrative medicine, it's a new era in health, and therefore it needs empowerment, support, policy, standards. Finally, I can say it's a global health, and it needs a global act. Thank you.
I think it's a great way to finish. So isn't it interesting, when we look at where we are today, we've got this ancient wisdom of integrative medicine with AI that can help it to be more precise. And we have the opportunity now to integrate it into our healthcare system. And I think what's so important about it, as our panelists have beautifully described, this is what patients want. And if we can create an integrated system that's not a fragmented system, I think we can only continue to elevate the way that we deliver healthcare here in our beautiful country of the UAE and across the globe. Would you like to please join me in thanking our panelists for this great discussion?